I have to disagree with doctors who are doing things for 40 years and doing the same thing, because that's why we have meetings like this. I mean, we're constantly trying to maintain our skills and maintain our skills at the highest possible level. But we absolutely do have folks who know how to treat patients, have been doing it for a long time, a lot of experience, and may not want to change as rapidly as somebody who's new and coming out. But across the board, we've always had our early adopters and our late adopters. We've always had the doctor who, the minute something new and different comes out, says, that looks great, I want to try that. I need to work with that with my patients. And then there's been the doctor who says, that's too new. We don't know what that means yet. We don't know everything about it yet. I'll wait a couple of years and talk to my friends who are using it, make sure that it's not a fad, that it's something that really is going to work and is going to help improve the care of my patients. But whether you're an early adopter or a late adopter, when a good therapy comes out, we all become adopters. And we just move at a little bit different rate. I think it's so important that we have a college, that we have a collegial environment that we can meet and talk in. So on the very highest level, we have the introduction of new ideas, the introduction of new therapies, the introduction of new research. So our speakers are providing the entire body with new data, with information, or updated data. So we have everything from our plenaries that are huge presentations to a large number of people all at the same time, trying to provide some of the newer material, to workshops that are more hands-on, that this is how you do this. So to have people actually be able to do things in a hands-on, interactive manner and learn new skills. But I think it's even more important that our researchers are able to come together, and this is just a wonderful place for researchers from across the country to come together to discuss what they're doing, discuss collaborations they have, potential collaborations that they can have. When one researcher talks about his or her research and what they're doing, of course, then others say, well, that's similar to what I'm doing, or that gives me new ideas about what I'm doing, and we take things forward in that regard. The third level now, I talked about the slow adapters, the people who need to talk to their friends and talk to their acquaintances and say, what's your experience with that new drug? And this is a place for that to occur. So social interactions that are really social and work interactions are very important. And that much more informal way of learning and interacting, I think, really helps us bring the entire profession forward. We're in the midst of what we call Vision 2020. This is an ongoing process that has occurred that is to, as I said, revitalize the college. And so what I want to do is to help make the college younger, to help make the college more appealing to our newer members, to help bring the college much further into social media, to make it easier to communicate through all different avenues of communication. And so our real goal is to focus on capabilities and increasing communication among all of our members. It seems to me that every time we think that we're on the verge of making things less consequential, diseases have a way of working with us and keeping us engaged. And we've seen a plethora of drugs go over the counter. And so we have patients who could say, I don't need an allergist, I have these allergy medications over the counter, I'll just go buy them and I'll take care of myself. I think that it's important to realize that the data shows that doesn't always work as well as it could. And so I think what we'll see is that we'll still be engaged in all of these different diseases, but we potentially will be engaged in a little bit different way, and we'll be engaged more as an educator. It's okay with me if medications are over the counter and you can go buy them, but somebody still needs to quarterback the team. Somebody still needs to say, given what you tell me, given your history, given your skin testing, this is when you're most likely going to have problems. Here are the things that you should avoid. And that's just not food allergy and avoid these foods and don't have anaphylaxis, but in terms of pollen allergy, in terms of being allergic to cats or to dogs. It's important to identify what it is that you're allergic to so that you can build that avoidance map. And so I think that the allergist is still going to need to be very much engaged in an educational process, if nothing else. And that asthma is a complex enough disease, even for the physicians who treat it, that I don't think it's a realistic expectation, even if all of our medications went over the counter, that someone would know how to sort through what medicines he or she needed without that guidance.